Generation Foundation.
Good afternoon, happy holidays, and welcome to the City Club of Cleveland. My name is Paul Harris, and I am a past president and current member of the City Club's Board of Directors. I'm very pleased to introduce today's speaker, Nan Roman, President and Chief Executive Officer of the National Alliance to End Homelessness. As stated at its website, the Alliance, quote, works toward ending homelessness by improving homelessness policy, building on-the-ground capacity, and educating opinion leaders, end quote. Today, Ms. Roman will educate our opinions on homelessness and thereby enhance the quality of civic discussion and debate on both the problem and the solution. Ms. Roman was born in Bloomington, Indiana, and earned her Master of Arts degree from the University of Illinois, where she graduated Phi Beta Kappa. She thereafter began her work addressing poverty and housing issues, working with local and national organizations, and developing her understanding and perspectives on those issues. She joined the Alliance in 1987, and as the Alliance's leader, has directed its program of public education, national advocacy, and capacity building with over 10,000 partner organizations across the country. In 2000, the Alliance introduced the concept of city plans to end homelessness. Today, over 300 cities across the country have adopted such plans, and the Alliance actively works with cities and states to design and implement their plans. The Alliance also hosts national conferences and training institutes on homelessness and its solutions. In our nation's capital, Ms. Roman works closely with members of Congress, congressional staff, and senior members of the administration in a multifaceted approach to issues affecting homeless people, including affordable housing, income assistance, education, job training, job placement, veterans, and service delivery issues. Ms. Roman serves on numerous boards, is frequently interviewed by the national and local press, and is a fellow of the National Academy for Public Administration. Her many awards include a National Women of Achievement Award issued by the Miss America organization, and that recognition she shares with several presidential first ladies, among others. I think Sharon Stone is one of the others. In reflecting on our speaker's lifelong work, it is very easy to draw comparisons to the early community and organizational work of the President of the United States. But in the true spirit of the City Club's 100-year tradition of informing citizens in a civil and nonpartisan way, I would note that Ms. Roman has served as an advisor to both Republican and Democratic presidents. Her work with partners across the country certainly evidences that ending homelessness transcends political boundaries. I am very pleased to present, on behalf of the City Club of Cleveland, Nan Roman, President and Chief Executive Officer of the National Alliance to End Homelessness.
Well, thank you so much for that introduction, Paul. I didn't know about Sharon Stone. Interesting. I've got to put that in my bio. And thank you so much for having me here. Congratulations to the City Club for its 100th anniversary. It is, I can tell you, absolutely an honor to now be part of that tradition, and I am very mindful of it and grateful for it. And thanks to all of you so much for being here to reflect a little bit with me today on the issue of ending chronic homelessness. I want to tell you about a man that I met several years ago where I live in the District of Columbia. His name, I'll call him David. He was disabled. He was in recovery from substance abuse disorders, and he had been diagnosed with bipolar disease and manic depression. He had gotten out of federal prison after 26 years. He went to a corrections halfway house for 6 months. He got a job, and then he moved to an Oxford house, which is a program of shared housing for people in recovery. At Oxford House, you have to have a job and pay the rent, and he had a job, but he got laid off. There was a layoff at his job, and he was the last hired, so he got laid off, and he had to leave Oxford House because he couldn't pay the rent. He became homeless. He lived on the street for a while, and then he went to a large shelter we have in Washington, D.C. That was the shelter that was started by Mitch Snyder, you may have heard of, CCND. He stayed at that shelter for the maximum of 6 months, after which he had to leave there, and he moved to a bench on the corner of 7th and Pennsylvania Avenue. It's kind of a meaningful corner because Pennsylvania Avenue, as you know, is the street that you will see the President and First Lady walk down next month after the inauguration. 7th Street is the street that the U.S. Department of Housing and Urban Development is on, just a few blocks on the other side of Pennsylvania Avenue. That bench, and I passed it a million times, probably many of you have too, and a big black satchel were David's home. While he was there, he was hospitalized twice for a total of 11 days. In both cases, he was suicidal. He also spent considerable time sitting in the emergency room waiting area of hospitals and traveling around the city on the bus and on the metro so that he could get basically out of the elements. He was considerably bothered by his inability to bathe and keep his clothes clean. Very dapper fellow. Because he is disabled, or was disabled, David received income assistance, about $220 a month. That was not enough to pay for housing. He applied for housing assistance at the time, and actually the same today in the District of Columbia, the waiting list for housing assistance was 40,000 people. After being homeless for a year and a half, he decided that the only thing left for him to do was to reoffend and return to prison, because at least in prison he could get a bed, a roof, meals, and a regular shower. It was at that point that his mental health caseworker sent him to a Housing First permanent supportive housing program. That program gets people very quickly into subsidized scattered site apartments, just apartments they rent in the community without a lot of preconditions, and it provides them with services. Although participation in those services is not mandatory, the program had a very sophisticated, still does, very sophisticated consumer-oriented services program that the tenants love, and they participate in it because it helps them and it's useful to them. Within a week of that happening, David had chosen an apartment from among several options and in several neighborhoods. He moved in. Actually, it's very near to where I live in the district. He had an incredibly supportive services team, and he was stable and looking for a job. It cost taxpayers at least $44,000 to keep David homeless and on the street. He was on parole and a client of the mental health system. The cost of his 2 unconnected case managers, about $20,000. He spent 11 days in psychiatric hospitalization. The cost of that, $15,400. He spent 6 months at the shelter, cost of that, $9,000. And it could have been a lot worse. David could have been placed in a psychiatric group home in the district, the cost of that, $60,000 a year, not including treatment. He could have been hospitalized at our mental health hospital, cost of that, $180,000 a year. He could have gone through with his plan and become reincarcerated, cost of that, approximately $65,000 a year. The cost for his supportive housing and services, the only one of those options in which he was neither homeless nor institutionalized, $20,000 a year. So this is basically the story I have to tell you. Obviously, permanent supportive housing is the solution to long-term homelessness for people with disabilities. We now have some 200,000 units of that housing in the U.S. You have been doing that kind of work here in Cleveland. Today I want to tell you the story really of how we moved from a homeless system that largely provided shelter, if that, as we saw in the case of David, to disabled people, to one that is really trying to end their homelessness with permanent supportive housing. And I want to reflect with you on what it is that we have to do to go to scale and solve the problem once and for all. When widespread homelessness first emerged in our country in the 1980s, initially we really thought that everyone who was homeless was a single adult male with a mental health or substance abuse disorder. That became and really remains today the stereotype of homelessness. If you ask someone on the street what homelessness looks like, you would probably hear a description very much like that. By the end of the 80s, with guesstimates of the size of the overall homeless population running to the millions, this huge number of severely disabled, unhoused people seemed to be millions of people with mental illness and substance abuse living on the street. It seemed to be a very overwhelming thing, with no clear solution being put forth about what to do, and temporary solutions like shelter were proliferating. By the 1990s, however, we knew better. We discovered through data and research that actually most people who become homeless, about 80%, were homeless briefly and only once, and that their homelessness was largely economic, caused by the mismatch between incomes and housing costs. There was, however, a minority of people, about 20% of people who become homeless, who had much more serious problems, the problems that really are attached to that stereotype. They had mental illness and substance abuse disorders, physical disabilities. And that group of people stayed homeless for long periods of time. They really couldn't get out of the shelter system as readily on their own as that other 80% did. This latter group became known as the chronically homeless population. When Dr. Dennis Culhane of the University of Pennsylvania developed the typology that identified this split between the bulk of homelessness and this much smaller group with much higher needs, he estimated that the size of the chronically homeless population was somewhere between 200 and 250,000 people in the nation. So this new emerging view of homelessness and chronic homelessness that came out of data and research really changed our whole view of what to do about the problem, because we had this huge, potentially millions of people with serious disabilities and no way to get out, to a group that was largely rotating through, but a much smaller group, 200 to 250,000 people who were very ill and living on the street. So certainly we thought we should be able to end homelessness for these 200,000 very, very ill people. But how to do that? What was the solution? It turned out that there was a creative group of social entrepreneurs kind of independently around the country that was coming up with an answer. In the earlier part of the 20th century, our cities had an abundance of what we call single-room occupancy housing or single-room occupancy hotels, SROs. We had, in the 60s, over 2 million units of single-room occupancy housing. Now, these units were not the greatest housing. They were very small. They often had shared bathrooms and facilities. But they housed a tremendous number of very poor, often disabled, single men and women, allowing them to pay for housing by the night or by the week, and providing a roof over their heads. Much of this SRO housing was really lost between the 60s and the 80s, and it's pretty much all gone today. There's very, very little of it left today. And of course, this big loss of stock housing several million people coincided also with the deinstitutionalization of people with mental illness from hospitals that was happening around the same time, which meant that there was an increased demand for this very affordable housing, and a much increased demand, but a much diminished supply of housing for them. By the 1970s, some urban pioneers in New York City, in Portland, Oregon, and elsewhere around the country began to rehabilitate the remaining vestiges of this SRO housing into much more decent housing, and to house people who were still in these neighborhoods. And they also began to enrich that housing with services, because the tenants they were finding had a lot of problems. They were disabled, living in these very distressed neighborhoods where the housing remained. And that really was the precursor to the permanent supportive housing as we came to know it today. By the 1980s, as homelessness really emerged, and this is a problem that basically emerged in the 80s in a widespread way, a few national leaders, like the fledgling Corporation for Supportive Housing, that was really in the 90s, Enterprise, ourselves, and also a high-ranking housing official in the first Bush administration, saw the potential in this emerging strategy of permanent supportive housing. Clearly, it made more sense to provide vulnerable, disabled people with a place to live and with services than to only provide them with shelter. A long story follows, but I think the bottom line is that over time, Research has showed us that this permanent supportive housing, subsidized housing, enriched with services that are focused not only on treatment, but also making sure that these vulnerable people stay housed, that they're stable in housing and connected to the community. Permanent supportive housing, we were finding, really did end homelessness, even for the most disabled people. And research over the years has confirmed this, that permanent supportive housing is effective for a minimum of 8% and often well over 95% of the people it houses. And I think here in Cleveland, you are, in the permanent supportive housing you've done, you are exceeding the national average there, I think, at over 95% stability in permanent supportive housing or moving into other permanent housing, but only 2% return to homelessness, if I'm correct. So that's fantastic. So thus, by the mid-1990s, we really had a problem of a solvable size, around 200,000 chronically homeless people, and we had a solution to that problem in permanent supportive housing. The third part of the equation turned out to be that that solution was affordable. An early set of studies showed that it cost the public sector, as I pointed out with David, at least as much to leave somebody with serious mental illness on the street as it costs to house them with services. A little counterintuitive. But why was that? That's because disabled people who are living on the street repeatedly and frequently interacted with, and still do, with emergency rooms, psychiatric hospitals, substance abuse treatment programs, corrections programs, public shelters, and a host of other acute care systems. There was a New York cost study by the same Dr. Dennis Colhane at University of Pennsylvania, looked at 4,000 seriously mentally ill homeless people over 4 years, and it showed that the cost to public systems of care in New York City of leaving someone with serious mental illness homeless and on the street was about $40,000 a year. The cost of housing them with services was about the same. Subsequent cost studies, very rigorous cost studies on people with HIV/AIDS and chronic street inebriates have actually found significant savings from housing these disabled people as opposed to leaving them on the street. So it wasn't just the same amount of money, they actually saved considerable amount of money. So these three things together, a problem with a solvable scale for which we have a solution, and a solution that is affordable, provided us with really a framework for how to move forward on this issue. If there were 200,000 chronically homeless people whose homelessness could be ended with permanent supportive housing that costs less than what we were already doing, by adding 20,000 more units per year, we could solve the problem. We could end chronic homelessness in 10 years. That was our, back of the envelope arithmetic to figure out how to try to move it forward. So before I talk about how we scaled up and what needs to be done to continue to do that, I just want to turn for a moment, and I know some of you are well aware of this, but for those who aren't, to some of the different models we have of permanent supportive housing around the country, because many improvements have been made to the basic approach of what it is. Excuse me. First, I think it's important to note that permanent supportive housing is generally created and run by nonprofit organizations. Public sector financing, however, is a key element, particularly for the ongoing rent subsidies that are needed. But there is also a lot of private capital and individual and foundation fundraising involved, particularly if there's development going on, as there is a lot of here. In fact, there are a lot of moving parts to financing permanent supportive housing. At a minimum, the rent subsidies will have to be provided and services will have to be funded, often to people who are not covered by public or private insurance. So that has to be figured out. And as I said, if development is involved, there are capital costs. So providing permanent supportive housing is a complicated business. It's not something that's simple. As to the models, there are the kind of more conventional single-site models, which is a lot of what you've been doing here, in which all of the units of the building are devoted to formerly homeless people. In a multifamily building, you'd often see studio or one-bedroom apartments with a kitchenette and or a bathroom. Sometimes in older buildings, you'll see still shared facilities because that was the way the buildings were built. Sometimes they have fairly intensive services on site with treatment and so forth, but sometimes not so much. It's really they have intensive case management and they're working to connect the people in the building to other services in the community. And I think that is somewhat more of the model that's followed here, although there's a mix. There's also a mixed-use model in which you also have a multifamily building, but some of the units are for people who used to be homeless and are disabled, and some of them are market rate units. So they're mixing members of the community with formerly homeless people. Again, the units tend to be small, the service models vary, and so forth. Increasingly, there is a scattered site model, and I understand you've done some of that here too, in which units are rented in apartment buildings. That's again what I was talking about in terms of with David, just housed in the community. The services are usually mobile or else they're provided off-site. And they're all different service models. Sometimes they're very intensive ACT team service models, which is an evidence-based practice where they have a team, has a psychiatrist, a medical practitioner, an employment person, a case manager that really surrounds the person. Sometimes they're more conventional kinds of models, intensive case management, linking people to service in the community. Depends on the people and what the community wants to do. They all seem to work pretty well. I also want to mention the Housing First movement. Your effort here in Cleveland to end chronic homelessness is called Housing First. This is also the words that are used to describe a movement that really emerged with respect to permanent supportive housing. Initially, prospective tenants in permanent supportive housing were typically required to have some period of sobriety before they could get into permanent supportive housing, or they were required to be on some mental health regimen and be compliant with services, to be ready for housing, to be housing ready before they moved into the housing. And the theory was that stays in shelter or transitional housing would achieve this, so people would get stabilized, and sometimes it's called the continuum of care, sometimes it's called the step ladder approach, so you're moving up. And it makes sense. But in the 1990s, the Housing First model emerged. And this model basically reversed that equation. It maintained that providing housing first and then services worked better than providing the services first and then the housing. It said that people needed stability in housing before the treatment services would really work very well. And it was really also based on a philosophy that people deserved housing, and that it was a right, and people should be gotten into housing, and that this housing readiness thing was kind of a myth. It really wasn't about housing readiness, it was about housing affordability. So it was a very consumer-oriented strategy, and there was a lot of resistance to it at first, but I think particularly with respect to chronic homelessness, it has clearly been a much more effective strategy. Because you could say that this chronically homeless population was proof that there was at least one group, and that was that group for whom the services first and then housing did not work, because they were not able to get stable, deal with their addictions, deal with their mental health issues while they were living on the street. By definition, they were staying homeless for years, 20, 30 years sometimes. So it has worked very, very well. And over time, it really has been adopted around the country and around the world now. And I think Cleveland has really been a leader also in ensuring that going after the really hard to house people and getting them right into housing. So back to the ending chronic homelessness story. The framework that emerged in the 90s, solvable problem, clear, cost-effective solution, allowed policymakers and practitioners to see a way forward, to really frame it as solving the problem and not just addressing the problem forever, and doing that cost-effectively. And so a lot of stuff started to happen. Based on research and advocacy combined, political will really got built. And I think you see that here too. Over time, at federal level, Congress, in a bipartisan way, targeted 30% of the nation's largest homeless assistance program, it's now about $2 billion program, to permanent supportive housing. And this basically required that every community in the nation begin to provide permanent supportive housing and began to target these high-need people who had been really being neglected. The Department of Veterans Affairs followed with its own permanent supportive housing program, HUD-VASH, and the goal was adopted most recently by the Obama administration, which has vowed to end chronic homelessness by 2015, as well as veteran homelessness. States and localities began to take up the challenge. Some state housing finance agencies began to require that their grantees do a percentage of permanent supportive housing in their multifamily developments, and the plans to end homelessness, which Paul referenced. In nearly every community have these components about ending chronic homelessness as well, and Cleveland's groundbreaking work has been an example of that. And the private sector has really gotten on board. The Sisters of Charity Foundation here is part of a national movement, really been a leader in a national consortium of foundations that's been dedicated to getting foundations on board behind permanent supportive housing. Financial institutions have made commitments. The new social impact bond movement around the country is focused to a great degree on permanent supportive housing. We also had to increase the capacity of those nonprofits to provide permanent supportive housing. Many homelessness organizations were initially disinclined to get involved in this strategy. They didn't have the will, or they didn't have the expertise to develop the housing or provide the more sophisticated services that are needed. Sometimes this is, as I said, complicated. Some felt that their mission really lay in helping people while they were homeless and not really in ending their homelessness. So that wasn't what they wanted to do. But the federal leadership, expressed through money, pushed the development of will and capacity, and national intermediaries like Enterprise here in Cleveland and others emerged to help with the financing, the technical assistance, the training, really to build that capacity that was needed, and that capacity grew. And all of these elements then came together and are geared towards scale. We're not going to get there to ending chronic homelessness if every single permanent supportive housing development is a one-off deal that everyone has to reinvent every time it's built. We really need the systems and the scale to get the scale to go all the way. And I have to say here again, Cleveland has been a leader. Cleveland has reduced chronic homelessness by 62%, by 62% since 2006. That beats the national, how much it's gone down nationally. So you really have been a leader here and made great progress, I think, by having a clear plan with metrics around it and pushing on those outcomes. So far I've made it sound like a no-brainer to end chronic homelessness, and it is. I maintain that, but there are a few challenges along the way. You might ask, for example, if we had 200,000 chronically homeless people and we've created 200,000 permanent supportive housing units, why we just counted that we have 100,000 chronically homeless people left during the last point in time count. Why haven't we 200,000 units, 200,000 people? Why haven't we solved the problem? A major challenge has been that these permanent supportive housing units do not all go to chronically homeless people. They're not always well targeted. Now, as I understand it, here in Cleveland, you have solved that problem, and you're really going after the hardest to serve people and trying to get them into the units first. And I think that will put you ahead of the game, because in a lot of places that doesn't happen, and there's a tendency to cream and not take the hardest to serve people. Another issue, I think, is that the innovation of permanent supportive housing has been so effective in addressing this very difficult chronically homeless population that is increasingly being proposed to solve a whole lot of other problems. It's like, well, if this is a thorny problem, why don't we just get people into permanent supportive housing? So the aging population, people with a lot of child welfare involvement, prison reentry, homeless youth, deep poverty. While the evidence base for permanent supportive housing solving all of those problems is not generally that strong, units nevertheless are getting diverted into that, and I think that has slowed down our progress in ending chronic homelessness. There are other issues as well. There are mismatches about where the units are and where the people are. So a lot of federal funding for permanent supportive housing is distributed by formula to communities across the country, but chronic homelessness is not part of the formula that they use for distributing it. So we end up having the units in places, or we have more so that we end up having the people in places where we don't have the units. I don't think there are a lot of empty units. And there is an emerging challenge that's being brought about by the Supreme Court's Olmstead decision. I don't know if you all are familiar with that, but that was the Supreme Court's decision about not institutionalizing people with mental illness. Institutionalization is being now interpreted to include housing too many people with a mental health disability in a single site, which would, of course, also threaten some larger permanent supportive housing buildings. So at the end of the day, we have not ended chronic homelessness yet, and we have not solved all the problems related to creating an adequate supply of permanent supportive housing. But we have cut chronic homelessness about in half, and by much, much more in some communities, including here in Cleveland. So what is the prognosis for the future? So we've cut it in half. We know it works. I think we're the more we do, the more confident we are we have the solution. I don't think there's a lot of discussion about that now. But can we go all the way? Can we go all the way and end chronic homelessness? Is that really a realistic goal for us as a nation? And is that a realistic goal for you here in Cleveland? Well, across the country, as here in Cleveland, this progress has been made. Chronically homeless population has been clearly identified, not just as a group, but individually by name. We know how many people there are. We know who they are. The scope of the problem has been assessed. We know how many units of permanent supportive housing we need. The target is an explicit goal nationally. The federal government, as I said, has established this goal of ending chronic homelessness by 2015, as well as here in Cleveland, which has set a unit goal around solving the problem. Progress gets measured regularly, so we know if we're making progress toward ending it, and the systems to produce the housing and fund the services are slowly but surely turning into a regular pipeline of assistance and making sure that the neediest people get into it. But there are challenges ahead. The continuing poor economy and its effect on public budgets is certainly if not the major challenge. I'm sure you all heard on the television this morning, as we hear every day, that the Fiscal Cliff is approaching, and yet again, today as yesterday, there's no solution in sight. That's obviously bad. That's going to mean cuts in funding through sequestration. While state and local budgets are expected to be better in coming years, earlier cuts really in most places have devastated social and human services. We are hearing for the first time from communities that even though they're housing more chronically homeless people, their numbers are not going down, and that's because they're starting to see more people becoming chronically homeless. And I think this is because of these human service cuts that came about in the earlier part of the recession. And we know that the core financing for permanent supportive housing from the federal government is threatened, as I said, by sequestration, by the debt, by the deficit, and by the strident partisanship in Washington that's making it harder and harder to craft bipartisan consensus around anything. So I think it's going to get harder to get the money, despite the fact that there are clear cost implications to not doing this. But there are opportunities also. There's the American Care Act with its potential expansion of health care coverage to all uninsured people. Many chronically homeless people are uninsured. That will be a help. And I think the pressure on the public budgets is making public systems of care look more carefully at what they call high flyers, or people that are using a lot these acute care systems. Those are chronically homeless people are right in there, so it may be that we'll get some additional increased attention there. I may be naive, but I am optimistic about our ability to end chronic homelessness in the U.S. and in Cleveland. You know, when you think about this whole story of ending chronic homelessness, it's kind of a surprising narrative, really, because this population, single adults living on the street, and in shelters, acting out their mental health and substance abuse and other issues in public because they're forced to do that by virtue of not having a place to live. It's not probably the first place you would expect to see a lot of public sympathy, to be honest. And yet the story of ending chronic homelessness has been a genuine success story. It has involved refocusing attention from a neglected population, a very extremely high need population, to that population, prioritizing them. It has been about solving a vexing social problem. It has generated enormous bipartisan political support nationally in almost every city in America. It's a huge success story, really, that's influencing how other social problems are handled. So maybe I'm an eternal optimist, but I believe that the story of David really does say it all. We can leave someone on the street to survive, and we can spend a lot of money doing that, or we can spend that money to solve their problem and our own. It's the smart thing to do to end chronic homelessness, and it's the right thing to do. And to me, it's obvious why there's so much public and political will behind ending chronic homelessness. Why wouldn't we end chronic homelessness? So I want, in closing my remarks, to thank you, give a big thank you to the City Club of Cleveland for deciding to focus on this issue. It's very much appreciated by us, and I know by the people who are working so hard with the Housing First Initiative here in Cleveland to make it happen. Thanks for inviting me to be here with you today, and thanks again to all of you for being here as well.
Today at the City Club of Cleveland, we are listening to a Friday forum featuring Nan Roman, President and Chief Executive Officer of the National Alliance to End Homelessness. We will return to our speaker momentarily for our traditional question and answer period. Please start formulating your questions now, and please try to keep them brief and to the point. We welcome all of you here and those listening to 90.3 WCPM Ideas Stream, WCLV, WTAM, or one of the many radio stations across the country. Our television broadcast partner is WVIZ PBS Ideas Stream. Television broadcasts of the City Club are made possible by Cleveland State University and PNC, and our live webcast is supported by the University of Akron. Closed captioning of our programs is made possible by the Nordson Corporation. We would like to welcome guests at tables here today, hosted by Baker and Hostetler, Cleveland Housing Network, Cleveland Mediation Center, Emerald Development and Economic Network, Enterprise Community Partners, Mental Health Services, Sisters of Charity Foundation of Cleveland, and Sisters of Charity Health System. Thank you all for your support. We would also like to thank the Sisters of Charity Foundation of Cleveland for their sponsorship of today's program. Joining us at the head table today are Sue Cray and Leslie Stranisha. Will you please both stand and be recognized? Thank you. We would also like to thank Enterprise Community Partners for helping to make today's program possible. And today is also the Norman A. Sugarman Memorial Forum on Philanthropy in America. We thank Mr. Sugarman for his generous endowment gift. Now we would like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphones today are Assistant Director for the 100th Anniversary Celebration, Betsy Wallace, and Program Director, Carrie Miller. First question, please.
Good afternoon. Thanks for coming. Cuyahoga County as a region was one of the first to suffer from when the housing bubble collapsed. And we have a lot of, not only do we have a lot of people without homes, but we have a lot of homes without people. Do you know of programs, and have you been working with communities in cities to try to match empty homes with people that don't have homes to find some way to make that correction?
Sure. I think there's a federal program, the Neighborhood Stabilization Program, that really provides some funding to try to match up the empty homes with people in the community and people with needs. And there are a lot of programs across the country, I think, that have been trying to take advantage of the availability and the lower costs and lower financing costs of some single-family homes and multifamily housing as well to try to address homelessness. So we definitely do see that happening. There are also models of permanent supportive housing that just involve single-family housing. In my own neighborhood, there are several. There are quite a few. Often you don't know about them, too, which is a good thing in the neighborhood. So I think there is an opportunity at the moment, to the extent that there's stock that's available, to try to get some of it and preserve its affordability, because over time it will go back up to try to address the homeless problem. Yes.
Speaking about homelessness today, you mentioned mental health, and of course there are many other ancillary issues that result in homelessness. poverty and broken families and all those related issues that we're so aware of. Over recent years, it seems to even a casual observer there's been much more sensitivity to dealing with those issues by one political party. And my question is, what do you think it would take to get Republicans, the other political party, to have the same sensitivity and the same awareness of these issues that you talked about today?
Well, let me say that, of course, the National Alliance to End Homelessness is an entirely nonpartisan organization. I don't know why you're laughing. I will say, to be very fair, that we have, over the years, had tremendous support for, particularly for ending chronic homelessness, from Republicans as well as Democrats. And if I had to say whether or not, historically, I think I would probably say we've had more from Republicans, to be honest with you. I think Democrats, we get more support from Democrats on the broader issues that you've identified. Anti-poverty, affordable housing, and so forth. I think the Democrats have been very supportive on those issues. The Republicans tend to be help more with the more acute problems and more vulnerable people. So it's been a bipartisan issue. But I guess to the larger point, I will say one thing that many of us in this field and related fields have noted over the years is the very or I guess questioned is, or wondered about, is why it is that housing affordability doesn't seem to really penetrate either party very deeply. It's not, I would challenge you to tell me of any discussion about affordable housing versus, say, foreclosure that happened in the last presidential election. I don't recall hearing. I think Mitt Romney said he was going to get rid of HUD. That was about as far as it went. It just does not penetrate, and yet, when we think about all of the host of social problems, I mean, how can we address child welfare issues, mental illness, or substance abuse, children's education, employment, returning veterans, reentry, you name it. Affordable housing is the platform on which people have to address these issues. And there's tons of data that shows that if health care is another big one, that if you don't have affordable housing and stable housing, we don't do a good job of addressing those issues, and we generate a lot of costs. And to those of us in the housing world, housing seems like the cheapest, best intervention there is that allows everything else to perform. But somehow, I don't think that message has really penetrated either party very, very deeply. This is my opinion.
Thank you so much. You taught me a great deal. I didn't know how much I didn't know. When you talked about mainstreaming homeless with non-homeless families, it triggered for me the issue of crime, and I noticed that you didn't mention anything about that in your comments, which were hopefully all positive. Could you talk a little bit about that?
Sure. I mean, generally speaking, homeless people are more victims of crime than they are perpetrators of crime. I mean, generally speaking, homeless people, to the degree that they're involved in the criminal justice system, which they are, it usually has to do with what's so-called status offenses. So things that they do because they're living outside. Because they're living essentially in public, they get arrested for doing things that most of us, have a house to go into and do. But there are some crime issues. Definitely, this is the case when the populations are mixed. I'll be honest with you. In these mixed buildings, I have not heard a lot of talk about increased crime or crime issues. It's if people have substance abuse issues, then you have to have control. There has to be some kind of control about how to their management issues about how to manage the building and make sure that there's safety and locks and so forth. But I haven't heard a lot of complaints that there's an increase of crime because of that with chronically homeless people.
We appreciate your remarks and support Housing First. I'm concerned particularly about a smaller portion of the chronic homeless. We operate the large emergency shelter for men, and that is the people with felonies, specifically sexual offenses, are often not permitted in housing programs. There's the not in my backyard. I wondered what other solutions have been found for these long-term continuing chronic homeless individuals.
Yes, that is a very, very difficult problem. People who've committed arson and sexual offenders are very hard to house. And in some states, you know, they're especially with people who have sexual offense convictions, there are geographic things, like they can't live within so many, do you have that here? Within, you know, certain distance of schools, and in Florida, the only place basically people can live is underneath the freeway. There's, so I think I can't say that I think there are a lot of really innovative solutions around that I know of. I mean, I think people have, it just takes a lot of determination to find housing, and sometimes it's separate housing, and, you know, arrange deals where there's different kinds of monitoring, having flexibility to try to make that work. It's very hard. And NIMBY is a very big issue everywhere too, not even for the chronic population in general, even for low-income people. And a lot of the cost of doing permanent supportive housing often gets driven up by the fact that the groups, as you all are aware, I'm sure, have to engage in these long NIMBY battles because the buildings are often resisted, even though I would say almost always, once they get built, they become assets to the community and people love them. But there are often these battles on the front end to stop them. And I think this is probably a good group in front of which to say it takes the community leaders really standing up and saying, no, we actually think this needs to, you know, people have a right to live in every community, and standing behind the developers in that case to get these buildings built.
Thank you, Ms. Roman. I'd like to ask you about tone of voice. And my question traces to your use of two adjectives, smart and right, in that order. Because it strikes me that your tone of voice is methodical, calm, analytical. That's the smart part, rather than moralistic and in any way strident. That's the right part, which you play second. I ask you whether or not this tone of voice that you've brought really quite wonderfully here today is a happy accident or a strategic choice.
Or whether I would tell you the answer to that question. I would say the tone of voice I use probably has more to do with the kind of person I am. And to me, to be honest, chronic homelessness and homelessness generally, it is offensive, and I think it's wrong. But also, it just seems such a solvable problem. It seems kind of a ridiculous problem for a country like the U.S. to have. And so to me, it's just I am offended by it, but also it's a practical problem that we are perfectly capable of solving, and we should. And I think that's generally how our organization largely leads on that issue.
Good afternoon. There's a large number of victims that really haven't been mentioned by name, and those are the children of the homeless. In the Cleveland School District, the number that I've been told lately is we're up to 2,500 homeless children within the Cleveland schools alone. So my question is, what kind of partnerships or relationships exist between Housing First and the school districts as far as transportation, getting the children to and from school, places like Beachbrook and other places that can deal with the kinds of issues that the children of homeless have?
Right. So today I've been obviously mostly focusing on chronic homelessness, which is about single adults. And so I haven't touched as much, as you say, on the issues of children. I will say on the chronic side that a lot of people who are chronically homeless, who present as single, have kids. and that once they get back on their feet and stabilize, which often happens, they reunite with their families, and it's a very positive development for families and for children to get back together. But that's not quite what you asked. I mean, the whole issue of homeless children is kind of a different in a different category. But housing, for the principles of Housing First, are also very important, if not more so, for homeless children. And there is a similar kind of parallel movement. It's really called rapid rehousing, but it's a Housing First movement about making sure that families with children also get rehoused very quickly, and attending to their school district, to not move because moving kids is really hard on them, and to connecting them with services in the community. So it hasn't been the focus, I apologize for that, of what I've talked about today, but I think it's another, you'll have to invite me back. It's another thing that's happening, a movement in homelessness to really end family homelessness and homelessness among children, and I'm glad you brought it up.
As a Republican, back in the 1990s, I was a member of the Coalition of Churches, and what we were tackling was emergency service for the homeless, i.e. normally fire. And we would take them into the churches and give them a place to home and take the kids to school every day. But the biggest resistance we got was from the school board because they weren't getting any taxes.
Yeah. Well, there are a lot of institutional players in homelessness, and that still is an approach that's used for these economically homeless too. I'm blanking on the name of the organization, but there's a national organization that that works in many communities where they shelter families every night, and then a different church will shelter them every night. And because it tends to lead to short lengths of time homeless because it's so disruptive, nobody wants to do it a long time. So that's good. There's an incentive to get them housed fast.
So I'm actually not going to ask a question, even though I know I was supposed to. It's really a plug for this community in the state of Ohio, and its response to 2 questions about crime. So if you're not aware, a report was just published in August by the Urban Institute, a research firm out of Washington, D.C., that analyzed the effectiveness of permanent supportive housing as a reentry tool here in this state. And Cleveland is one of the cities that was part of the pilot. And what was discovered was that if people with criminal histories and homelessness and behavioral health issues are actually placed in supportive housing with the supports they need, they actually will not commit crimes. They don't go back to prison, and they're not rearrested. And so that information is available on the Urban Institute's website. And I also want to just give a plug to the 2 providers here in Cleveland that have made a difference in terms of that evidence coming forth, and that's Eden and MHS and their good work.
Thank you so much for coming to Cleveland and for your good work. What role should shelters and transitional housing play in connection with the chronically homeless population?
Well, that's a very good question. And I think, sometimes in the course of this history I described to you, permanent supportive housing has sort of been pitted up against shelters. We should stop just providing shelter and we should provide permanent supportive housing. But in reality, shelter is the entryway into permanent supportive housing for many people. And I think that there's a lot of thinking going on now to reconceptualize the shelter system and try to figure out how it can function even better than it has. I mean, for most people, shelter works very well, and they don't stay very long, and they leave, and that is all good. And sometimes chronically homeless people are on the street, but more often they're either in shelter or in and out of shelter, and it provides a very important function, and we need to recognize that and support it and I think improve it. Transitional housing I think there probably is a role for transitional housing, particularly around substance abuse issues and recovery programs and so forth, which a lot of transitional housing for singles does do. So I think there, where people need to go through recovery and be in some residential recovery program, the transitional housing can function for the chronic population.
Hi. I'm interested in the data that speaks to the success of movement of people from the permanent housing to being self-sustaining. And is there any percentage that you can tell me about that? How successful are you through services and employment? How that works?
Well, there's been an increasing emphasis in permanent supportive housing on employment, and there's been increasing employment in permanent supportive housing. I mean, obviously, if you're targeting the permanent supportive housing well, the majority of tenants are people with very serious disabilities who are going to be, it's going to be difficult for them to be self-sustaining, self-supporting through employment. But that doesn't mean, A, that they can't be employed, and and increasingly they are, and B, that they don't want to be employed, because most of them do. They don't want to sit around all day. They want to work. So I think this is an area where permanent supportive housing really has been improving since it emerged. Yeah.
Today at the City Club of Cleveland, we have been listening to a Friday forum featuring Nan Roman, President and CEO of the National Alliance to End Homelessness. Thank you very much, Ms. Roman. You were outstanding. Thank you, ladies and gentlemen. This forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
PNC is proud to support the presentation of this City Club of Cleveland Friday Forum on WVIZ PBS.
Additional support comes from Cleveland State University. Support for closed caption transcripts of City Club forums is provided by the Nordson Corporation Foundation.